Ever wondered what dengue fever is and why it's a global concern? Well, let's dive right in. Dengue fever, often just called dengue, is a mosquito-borne disease. That means it's passed on to humans by mosquitoes, specifically the female Aedes aegypti mosquito. Now, why is it a global concern? Dengue has become prevalent in over 100 countries around the world, especially those in tropical and subtropical regions. These include parts of Southeast Asia, the Pacific Islands, the Caribbean, Mexico, Africa, and Central and South America. Dengue fever is not just a one-time illness. It's a recurring problem that affects millions of people every year. And with increasing global temperatures, the mosquitoes that carry this disease are spreading to new areas, making dengue an even more significant health concern. Understanding dengue fever can help us protect ourselves and our loved ones from this disease. So, let's delve deeper into the causes, symptoms, and treatments of dengue fever in our upcoming scenes. So what causes dengue fever? It's not as mysterious as you might think. The main culprit behind this fever is a tiny creature that you might not even notice. The Aedes mosquito. This particular species of mosquito is the main transmitter of the dengue virus. Here's how it works. The Aedes mosquito becomes a carrier of the dengue virus when it bites a person who is already infected with the disease. Once infected, the mosquito is now primed to spread the virus further. It does this in the simplest and most natural way it knows how, by biting others. However, it's important to note that dengue fever is not directly transmitted from person to person. The virus needs a vector, in this case, the Aedes mosquito, to move from one host to another. Knowing the cause is half the battle, isn't it? But recognizing the symptoms is equally important. Have you ever wondered how to recognize dengue fever? The symptoms might surprise you. Dengue fever, a mosquito-borne illness, sets in stealthily but can quickly escalate if not identified and managed properly. Typically, symptoms begin 4 to 7 days after the mosquito bite. Yes, from the 4th day onwards, one might start feeling the onslaught of this disease, and these can last anywhere from 3 to 10 days. The initial symptoms are often mistaken for a common flu. A high fever is one of the most common symptoms, often reaching up to 104 degrees Fahrenheit. Accompanying this high temperature is a severe headache, often described as a pain that feels like your head is being squeezed in a vice. Another significant symptom is pain behind the eyes, which intensifies with movement of the eyes. This is not something you typically associate with your common cold or flu, making it a telltale sign of dengue fever. The disease doesn't stop there. It brings with it severe joint and muscle pain, earning it the nickname breakbone fever. Imagine waking up with tired, aching muscles and joints that make every movement a Herculean task. Fatigue, nausea, and a skin rash, which appears 2 to 5 days after the onset of fever, are also part of this disease's repertoire. The rash could spread from the torso to the arms, legs, and face. With such varied symptoms, it's crucial to seek medical help for a proper diagnosis. Dengue fever sounds scary, but what can we do about it? When it comes to treating dengue fever, it's important to know that there's no specific treatment available. Instead, the care is primarily focused on relieving the symptoms and making the patient as comfortable as possible. Early recognition plays a critical role in managing the disease effectively. If you or someone you know starts exhibiting symptoms of dengue fever, such as high fever, severe headaches, pain behind the eyes, or joint and muscle pain, it is crucial to seek medical attention immediately. Prompt supportive treatment can significantly lower the risk of complications and improve the patient's prognosis. Hydration is key in the treatment of dengue fever. Drinking plenty of fluids can help maintain the body's water balance and support the immune system in fighting off the virus. Pain relievers can also be used to manage the discomfort caused by the symptoms. However, it is strongly advised to consult with a healthcare professional before taking any medication. There's also a dengue vaccine available, which is recommended for individuals who have been infected before. While the vaccine doesn't guarantee full protection, it can considerably reduce the risk of severe dengue and hospitalization. Remember, prevention is always better than cure. Stay safe and keep those mosquitoes at bay.